My name is Julie Elbert, and I am the director of the Behavioral Health Department for Winnebago Public Health. The Behavioral Health Department focuses on mental and emotional wellness, and we work with individuals to teach healthy coping skills and ways to alleviate symptoms that may lead to depression or anxiety. We also work with individuals that are struggling with substance use problems or chronic conditions that they need support with. We have a staff of 4 therapists and 1 substance abuse counselor. Latasha is our registration person at the front desk. And we also have a psychiatrist, Dr. Patra, that's here once a week. And we are able to provide many different services to support the Winnebago community and surrounding areas. Individuals who are interested in receiving services in our department can call the hospital and be transferred to behavioral health, or call directly to our line. You don't need to have a referral from a different department or from a doctor to get services here. We do get referrals from patients who have visited the emergency room or from outpatient. And sometimes we get people that are referred to us from Sioux City or other communities who are interested in getting services here. We provide assessments for substance use disorders. If someone believes they might need to go into treatment, we can provide an assessment and help with the referral and application process so that individuals can obtain treatment services.
Hi, I am Nicole Wells, and I'm one of the mental health therapists here for the Public Health Department. I see kids and adults. I see kids as young as probably 3 years old, and adults, well into their 70s or 80s. So I see a wide range of clients, and my mental wellness tip is to disconnect from electronics and social media. So to consider adding an electronics-free time period to your day. Take the time to unplug and disconnect from the constant stream of emails, messages, and alerts. This will allow you to interact more with people face-to-face, and it might also help to reduce some of the negative feelings that social media can often stir up for people.
So my name is Megan Wilson, and I work for the Winnebago Behavioral Health Department, and I see adults and kids. A tip that I would give would be mindfulness. Mindfulness includes things like yoga, meditation, tapping, and so I encourage all of my people to download a meditation app. Usually they're free, and a lot of times I'll use it throughout the day. And they have meditation apps for kids and adults, and usually there's both. So the one I use, I often just meditate like for 5 minutes here or there when I'm kind of scrambled. And I use it for my son at bedtime too. And oftentimes he never makes it. Well, actually, he's never made it to the end.
My name is Jenny Tobin, and I'm just hired on as a mental health therapist here. My tip for the day would be to really focus on getting your sleep every day and having a good schedule for that. So to work on your sleep, you can do that throughout the day by getting up at the same time, get some exercise during the day, stop caffeine and alcohol within 3 hours of sleeping. And 1 hour before sleep, make sure you're off the TV, off your phone, doing something relaxing. And then get to bed on time. For adults, we need 8 hours of sleep. Kids and adolescents between 9 and 11, based on their age. Think about from the time you need to wake up, back up those hours to figure out the perfect bedtime for yourself. And an hour before that, make sure you're doing calming activities like reading, taking a bath, listening to soft music, something like that. And every night go to bed at that same time and kind of have the same routine. And your body will recognize that and start getting into a good healthy pattern of, oh, I recognize this pattern, it's time to get ready for bed. And you can start helping yourself calm down. So when it's time for bed, you're ready to get to sleep. And that'll help you throughout the day to have more energy, stay more focused, make better decisions. So that's your mental health tip for today.
My name is Jillian Kelsey, and I work in the behavioral health program as a substance abuse counselor. And my mental health tip for National Public Health Week would be to not be afraid to say no and to set healthy boundaries with others. An example of that would be, if I had time to relax this evening, and somebody wanted me to go do something with them, but I already set aside this time to relax for the evening, I would probably have to tell them, respectfully decline. And, even though I might be at home purge watching TV, that's still something that I had set aside for myself. And, I'm going to respectfully put a boundary in there and tell them, like, no, I can't make it tonight.
Hi, I'm Aimee Clancy, mental health therapist here at Winnebago Behavioral Health. My mental health tip for today is to get out into nature and enjoy the fresh air. Go for a walk, reconnect with the outdoors, listen to the sounds of nature, observe the beginning of spring and all that is beautiful about the world we live in.
People don't have to have an appointment to come in, so you can call in and talk to someone the same day. If you're comfortable with coming in, we do require that everyone wears masks, and we try to work people in if they come in, and or if they're in crisis, that we will have someone see them and talk to them. We also have an after-hours phone that is available, so people can call the after-hours number and talk to a person and hopefully get some comfort through the opportunity to have immediate contact with a person.
Happy National Public Health Week
From the Winnebago Behavioral Health Department. Yay!